Welcome to the WRAL Daily Download. I'm Luis Fernandez. As we get closer and closer to those cool months of the year, respiratory illnesses start to get closer and closer to the front of your mind, which brings us to COVID-19 and the COVID-19 vaccine. Who is eligible for the vaccine could be changing. We've gotten a lot of questions from the community about it. WRAL's Ashley Rowe joins us now. Ashley, thanks so much for being here.
It's great to be here.
So, first off, let's just get this out the way, right? Who is currently eligible for the COVID-19 vaccine?
Well, I wish that I could give you a really clean answer, but it's sort of twofold. So first, on the one hand, the FDA has recommended this vaccine for people 65 and older or people 6 months and older with a pre-existing health condition. And those conditions are quite broad. You can find those conditions on the CDC's website. So you can go with a doctor's note. If you meet those eligibility criteria, you can get a doctor's note from your primary care physician and go to a pharmacist and get the shot. Now, I also spoke with the North Carolina Department of Health and Human Services, and they say that COVID vaccines currently are only available from a pharmacist in North Carolina for those ages 18 and up with a prescription. So already we're seeing a little bit of discrepancy. And as you'll see throughout our conversation, confusion is the underlying theme here.
Mm-hmm. Yes, that seems to be the case. So just the situation in general feels a little bit different this year compared to years past when we've dealt with the COVID-19 vaccine. Why is that? What has changed? What is shifting?
On August 27th, the FDA issued its recommendation for this season's COVID-19 vaccine. At the same time, they ended the emergency use authorization. Remember that EUA? We talked about it a ton during peak COVID times. Well, they've ended emergency use authorization for the existing COVID vaccine. So that means that it makes it a little bit more complicated to get the vaccine out to the general public. Now it follows the same kind of vaccine schedule system that, for example, the flu shot has. So once the FDA issues its recommendation, then it goes to a panel with the CDC. It's a Federal Advisory Committee on Immunization Practices. I know it's a fancy
a mouthful.
Exactly. The ACIP, let's call it that for short. This panel is set to meet on September 18th, and this panel looks at the FDA's recommendations. It issues its own recommendations. Historically, public health officials tell me the ACIP's recommendations tend to be aligned with the recommendations from the FDA. But this year, they don't know what that could look like. Remember, the FDA on August 27th recommended the COVID vaccine for people ages 65 and older and people ages 6 months and up with a pre-existing health condition. So the big question here is the panel going to follow that recommendation and keep the eligibility narrow to that, or will it broaden it so that anybody can go to the pharmacy and get their COVID shot with their flu shot?
A lot to kind of parcel through there. Let's talk about that panel for a second, the advisory panel, the ACIP. Who are they? What is that group? What do we know about that group in general?
Well, they look at the FDA's recommendations. They look at the vaccine, and they decide on their own, is this the vaccine that we want to put out, market to the general population? How do we want to go through this? You've got the FDA and then you've got the CDC. These are two totally separate agencies. They're looking, this panel almost aligns them with regards to the recommendations. And as I mentioned, historically, public health officials say what the ACIP does is generally aligned with what the FDA does.
So why is there so much confusion this year? Like, you mentioned it before we even started doing this, sitting here recording this podcast. We've gotten a lot of your emails, messages, just saying, hey, what do I do? What's going on? Why is there so much confusion?
Well, people are going to the pharmacy thinking like what they've done in previous years when the COVID vaccine was under emergency use authorization and you didn't need a doctor's note in order to get this COVID vaccine. People are going to the pharmacy thinking that they can get their COVID shot, and they're being turned away, saying you need a doctor's note. Well, a lot of people, they're not going to go to their doctor to go and get a doctor's note so then they can go to the pharmacy and get the shot. People want a more seamless process. And that's actually a huge concern for public health officials, local public health officials. I was speaking with the medical director of Durham County Public Health, and he was telling me his big fear is that if it's not broad eligibility, if the recommendation isn't for the general population, then what could happen here is you've got folks who are they don't have a primary care physician. They don't know how to get that doctor's note. Or maybe you've got somebody who works in a job that doesn't allow them to be able to go to their doctor's office for, in the regular business hours to be able to get that doctor's note so that they can then go to the pharmacy and get their COVID shot. And this is a group who really wants to have, general population immunization. They're pro-immunization. And so any barrier to immunization is something that they see as a bad thing.
And from what you're saying, too, it sounds like it's not just the consumer of this vaccine that is confused. It's the people who would be administering it and prescribing it and things along those lines. There's confusion there as well. I
specifically asked the medical director of the Durham County Public Health Department, is there anything that you can predict ahead of the ACIP's meeting on September 18th when they're going to be evaluating the COVID vaccine? Do you have any idea what's going to happen? And he flat out said no. He really doesn't know what's going to happen. And so when you've got the medical director who's not really sure about what to tell people, how does the consumer handle it? And so the trickle-down effect has just been confusion layered on confusion.
Let's take a quick break. When we come back, we'll learn more about the possible schedule for when we'll know more about the vaccine availability this year. Welcome back to the WRAL Daily Download. We're talking with WRAL's Ashley Rowe about COVID-19 vaccination availability. So we've addressed the confusion. We've talked a little bit about kind of the background of what's setting all of this up. So what about the actual timeline? You mentioned it briefly before the break, but if people are interested in getting a COVID-19 vaccine, what days should they be looking at for when they can find out more information?
The ACIP, that Advisory Committee on Immunization Practices with the CDC, they are meeting on September 18th. That's when we should be expecting to get some sort of understanding of what their guidelines are going to be for this COVID-19 vaccine. Now, I asked the North Carolina Department of Health and Human Services, is it unusual for the flu vaccine recommendations to be separate from the COVID vaccine recommendations? Their answer was that the timing for the ACIP flu recommendation was not different from past years. What is unusual this year is not having ACIP recommendations for COVID vaccines at this point. So what's unusual, let me just reiterate that, what's unusual is that we still don't have the recommendation from this advisory panel with the CDC. I also asked the DHHS, is there precedent for the ACIP recommending vaccines for some populations but not all? We were talking before the break about how the FDA recommended it for certain populations but not everyone. And they said yes. ACIP often makes recommendations that are specific to certain groups based on age or medical conditions or other considerations. So again, the big question is, September 18th, after the ACIP meets, will that guideline be for everyone to have access to the COVID-19 vaccine or just specific populations?
So that mid-September time is what people should really be looking towards if they have questions just in general about this, because this is complicated. There's a lot of confusion for a reason. Are there any kind of recommendations of who to reach out to, where to get more information?
Well, I can't say that I have verified this, but I have been told that if you get turned away at a CVS clinic or at a Walgreens, for example, apparently the Minute clinics are giving COVID-19 shots. Don't take my word for it, but that is what I'm hearing from local public health officials. As far as if you've got questions, your local public health department will likely have the best answers for you. But again, you're really going to want to talk to your primary care physician if you have one, so that you can get their take on all of this as well.
That's WRAL's Ashley Rowe. Ashley, thank you so much.
Thank you.
I'm Luis Fernandez. Thanks for joining us, and thanks for listening to the WRAL Daily Download, and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.